Can type 2 diabetes be reversed or cured? Type 2 diabetes is characterized by the body's poor ability to respond to insulin resistance. Insulin is the hormone responsible for regulating blood sugar levels. When we say blood sugar, we really mean blood glucose. Both terms are used interchangeably. Reduced insulin sensitivity results in consistently high blood sugar. If blood sugar levels are consistently high, then there is a high risk of developing type 2 diabetes. This is usually known as prediabetes, aka impaired glucose tolerance. You can think of blood glucose levels as a continuum, with prediabetes and type 2 diabetes being points along the spectrum. Rather than curing type 2 diabetes, recent research has suggested that the condition can be reversed for some people following extensive weight loss. For individuals where this is possible, it means moving from the type 2 diabetes point on the spectrum towards the healthy blood glucose point. How do we measure the reversal of type 2 diabetes? The usual marker of having reversed type 2 diabetes is when the condition is put into remission. There is some debate about the exact definition of remission. Defines remission as meeting these three criteria. Weight loss, A1C levels at less than 48 mmol per mole on 2 venous blood tests within 6 months, achieving the above after coming off all diabetes medications. A1C, glycated hemoglobin, refers to red blood cells that have glucose attached to them. A1C levels are used because our blood glucose levels constantly change throughout the day based on what we eat and physical activity. Taking a one-off blood sugar measurement at a specific time point doesn't help us to diagnose type 2 diabetes. When the body isn't able to use glucose properly, as with type 2 diabetes, it sticks to the red blood cells and circulates through our blood vessels. Since red blood cells have an average life of 3 to 4 months, A1C helps us to see the average blood glucose levels over a 2 to 3 month period. For an individual with type 2 diabetes, the aim is to A. Get into remission and B. Get A1C levels as close to the healthy range as possible. It is worth noting that the table above is a rough guide that can be useful for diagnosis, but it is still possible to have type 2 diabetes with an A1C level below 48 mmol per mole. How do we achieve remission? Significant weight loss appears to be the most effective way to achieve type 2 diabetes remission. Professor Roy Taylor, a leading researcher of type 2 diabetes, and colleagues at Newcastle University conducted the first ever dietary and lifestyle intervention trial with remission as the primary endpoint. This was called 320 participants, all diagnosed with type 2 diabetes within the last 6 years, were randomized into either the intervention group or the control group. The intervention was a very low-calorie diet program. Participants dramatically reduced energy intake to 850 calories a day and then were slowly reintroduced to a regular, healthy diet to maintain weight loss. The control group received the usual current treatment on the NHS for type 2 diabetes. This study is ongoing, but so far the results have demonstrated that after 1 year, those in the intervention group lost significantly more body weight, average of 10 kgs, compared to the control group, average of 1 kilogram. In addition, 46% of the intervention group went into remission, compared to only 4% in the control group. These results suggest that significant weight loss can reverse type 2 diabetes and result in regular insulin activity for some, even if the individual has been diagnosed up to 10 years ago. To achieve significant weight loss, the DIRECT study placed participants on a low-calorie shake diet. This diet dramatically reduced overall energy intake. Although effective in the short term, we do not think low-calorie shakes are the easiest, healthiest, most cost-effective, or most sustainable approach to weight loss. This approach doesn't teach people how to live healthily, only that there is a short-term fix that can be applied. Our understanding of the scientific literature is that it is far more effective in the long term to achieve weight loss and remission through a healthy lifestyle and behavior change. So does significant weight loss cure type 2 diabetes? The simple answer is no. Type 2 diabetes cannot be cured, but evidence suggests that significant weight loss can reverse the condition in some people. Once in remission, it is essential to maintain the weight loss, otherwise type 2 diabetes will return. Professor Taylor suggests a mechanism for how type 2 diabetes occurs, which explains why failing to maintain weight loss in remission leads back to diabetes. Overeating leads to excess fat in the liver. The liver responds poorly to insulin and adds more glucose to the blood. Excess fat in the liver is passed on to the pancreas, causing insulin-producing cells, pancreatic beta cells, to stop working. Losing weight reduces fat inside the pancreas. This restarts the insulin-producing cells, resulting in the normal production of insulin. Weight gain takes you back to step 1. Can everyone achieve remission? Despite losing weight to below their personal threshold, some people can't achieve remission. Professor Taylor acknowledges that a reduction in liver and pancreas fat is dependent on the ability of pancreatic beta cells to recover. If these cells are damaged beyond repair, perhaps from having type 2 diabetes for a very long time, then significant weight loss is unlikely to reverse diabetes successfully. In his prize-winning lecture about the pathology of diabetes, Professor Roger Unger suggests that the buildup of fat in the pancreas causes ceramide to accumulate in the pancreas. Ceramide is toxic and kills pancreatic beta cells. It is possible that having type 2 diabetes long enough, 10 years plus, without treating it leads to too many pancreatic beta cells getting destroyed by this process. This means that even if individuals lose weight to below their personal fat threshold, they will not be able to go into remission. This highlights the individual variability of type 2 diabetes and the complex systems at play when we talk about reversing it or going into remission. This could partly explain why not all of the participants in the direct study who lost a significant amount of weight went into remission. Perhaps some participants didn't lose enough weight to reach below their personal fat threshold, and those that did but didn't achieve remission possibly had irresolvable pancreatic damage. Thank you for watching the video. Don't forget to like, subscribe to my channel and comment your opinion. Finally, click on the link in the description to support me.